I just wanted to talk a little bit about inflammation markers. As you can see from the recent research about coronavirus and who gets the most serious complications of it, we see that it's people who suffer from diabetes, high blood pressure, and obesity. So what's common with these with all these diseases? The common thread is that these diseases show up as a result of the inflammation in the body. So how to know if you're inflamed or not? When I see a lot of people, a lot of news articles talk about the healthy person died, and it's very unfortunate. The healthy young person died from COVID-19. I wonder what his or her labs look like. Sometimes I can look at the picture and see, well, this person had metabolic disorders. If the person looks like he weighs 400 pounds, unfortunately, even if he is young, the complications can be severe and cannot be managed within one day or with one vaccination. The other issue that we are facing, there are some research articles that show that people who are overweight or obese may not respond to the vaccination. They may not develop antibodies at the level that would be enough to protect them. And it goes almost to any person who suffers from obesity. Let's get rid of stigma. Let's discuss this issue as it is the metabolic issue, because at some point it's not about how much you eat and how much you exercise. It's about hormones that take over your body and they make you get bigger and bigger. So my point of this video is to discuss not only those who are obviously metabolically compromised, but someone like me, for example, who is skinny fat. So if you've heard that notion, sometimes the hormone imbalance in the thyroid hormone can cause you to have high blood sugar, and high cholesterol. So in my case, it's not the cholesterol that got that got sorry about that they got into the picture, but in my case it's the higher blood sugar that I experienced because my thyroid hormone was lower, and because my thyroid gland is not working properly. So the point of this video is also to educate you and tell you, okay, how do you know that you have inflammation in your body? What should we check for? Did your doctor check recently? Has your doctor checked recently the inflammation markers that could be very insightful in what's going on? Do you have a fire in your body that needs to be extinguished, or you're just fine and you're in a zen state of happiness and relaxation? And that's very important to know this now when we're dealing with this pandemic, because as I said, the people who have the most side effects or most complications, they are not healthy people. Only a few healthy people die. So let's be straight about the facts that we need to start thinking about our health now, not when the next pandemic hits. So if you would like to, I'll put the list next in the comment of what I would ask my doctor to check in my blood work next time I see him or her, or your healthcare practitioner, it doesn't matter. But the most important inflammation markers I would check is CRP, C-reactive protein, high sensitivity. So this is the marker that shows if you have high inflammation in your body. It doesn't tell where your inflammation is coming from, but it tells that you do have inflammation and that something needs to be addressed to decrease it. Homocysteine, this is another marker of inflammation. Homocysteine is just an amino acid, right? Proteins consist of amino acids. Homocysteine, if you do not have enough B vitamins, B12 and B9, or if you have MTHFR and other mutations in the methylation cycle, not just MTHFR, you may need an increased level of B vitamins, and this if you have deficiency in those, in some other things, but mainly B12 and B9, your homocysteine level could be high. So the optimal range is 6 to 7. I see a lot of patients who come to me and their level is 15 or 10. So the issue was that amino acid homocysteine floats in your blood vessels and lodges into the blood vessel walls, and it causes the inflammation. So that's another issue that can predispose someone to heart attacks, to cardiovascular problems or heart issues, and to strokes. So should we wait till the stroke happens and then check for homocysteine level, or should we do it now? And other labs that you can check is vitamin D. It's huge for immune health, and unfortunately, even in Arizona, every other patient who comes into my practice has vitamin D level lower than 20. In Arizona, where we have 365 days of sunshine. People put sunscreens on, they don't go in the sun in the middle of the day, so vitamin D is low. So the other very cheap markers is CBC and CMP. And those are amazing because you can pull, if you know how to interpret them, you can pull a lot of information from them. Are you deficient in B12 and B9? Are you deficient in iron? Where is your white blood cell count? How is your liver doing? How are your kidneys doing? Those are, and how is your blood sugar, fasting blood sugar? And thank you for watching me. So the other thing I would check in almost everybody is the thyroid health, thyroid function, TSH, thyroid stimulating hormone, free T3, free T4, and reverse T3, and the antibodies. If your doctor is open to that, do the full thyroid panel, which would include total T3 and total T4. These are the very basic inflammation markers. And if you have any doubt that you are having something with the insulin resistance, I would definitely check the fasting insulin. Okay, hope it was helpful. Let me know if you have any questions, and I'll post the list of the labs to check in my comments. Bye.